Hospital consultants have fought off a bid to strip them of bonuses worth up to £77,000 a year. The payouts are supposed to reward excellence but go to half of senior doctors on top of their £90,000 average salaries. The scheme costs the NHS around £320 million a year, enough for 12,000 nurses or 33,000 hip replacements, pledging reform. Jeremy Hunt has described the flawed arrangements as disastrous. The Health Secretary insists that performance-related pay must reflect quality and responsibility rather than time served. But the British Medical Association took legal action to protect the bonuses and has reached an out-of-court settlement with the Department of Health, saying the payouts cannot be threatened with withdrawal. Instead, hospitals must offer consultants the chance to apply for a new or more generous annual award. Campaigners said extending the scheme beggared belief amid intense financial pressures, cutbacks, and a 7-year pay freeze for nurses. Paying consultants huge bonuses while leaving others locked in low pay is unfair and unsustainable, said Judith Jolly, the Liberal Democrats' health spokesman. Worryingly, there remains a clear gender pay gap in the health sector. Male consultants are all too often paid more than their female counterparts. While we cannot put a price on the importance of saving lives, we must ensure that all those who work tirelessly for the NHS are given fair pay. Routine operations including hip replacements are already being rationed, and patients will soon be denied cough mixture, migraine pills, and heartburn remedies on prescription. John O'Connell of the Taxpayers Alliance said, "When the NHS is struggling to provide basic services to people, it beggars belief that these unaffordable bonuses are still being given out freely, often regardless of performance." Doctors and nurses should refer to each other by their first names in an effort to cut down on patient deaths. Health Secretary Jeremy Hunt said yesterday, "In the UK we are still very hierarchical in medicine. It's one of the only professions where we are talking about MR this and drive that rather than first name terms," he said. In an operating theater, if you have a hierarchy, you only have one pair of eyes spotting a mistake. Whereas if you remove the hierarchy, you can have 8 or 9 pairs of eyes spotting those potentially lethal mistakes. He added that the current system makes it practically impossible for doctors and nurses to be completely honest about their conduct. He was speaking at the World Patient Safety Summit in London, where he announced plans to bring 2,000 pharmacists into GP surgeries in order to catch prescription errors. The move comes as research commissioned by the Health Department highlighted how more than 200 million medication errors are made in the NHS every year. The mistakes could contribute to up to 22,000 deaths annually in England. The government must take a very close look at this scheme and ensure that taxpayers' money never gets wasted on bonuses for staff who don't deserve them. Consultants have been paid big bonuses ever since the health service was founded in 1948. The then Health Secretary, Labour's Aneurin Bevan, reportedly admitted to stuffing their mouths with gold to stop them switching to private hospitals. The Clinical Excellence Awards are paid out to half the 46,000 consultants in the NHS, as well as to some GPs who do research. There are 12 levels ranging from £3,000 to £77,000, and successful doctors receive the payments for 5 years, after which they can apply to have them renewed. They are rarely withdrawn, and many doctors receive them for the duration of their careers. Men are much more likely to be handed the highest bonuses than women, raising concerns that the scheme fuels the gender pay gap. A source at the British Medical Association said the deal was far better than consultants had hoped. Many had feared the awards would be scrapped altogether, or at the very least that the top £77,000 payments would be cut. The arrangement will anger thousands of nurses whose pay has been frozen for 7 years. Their average salary is £25,000 a year. The bonuses have counted toward consultants' pensions on top of their final salaries when they retire. Awards granted after April will not qualify for this treatment. The agreement is expected to be announced within the next few days by the Department of Health. The BMA and NHS employers, the body which represents hospitals. The Department of Health is still locked in talks with the BMA about overhauling other aspects of the consultant's contract. Officials are trying to remove the clause that lets the doctors refuse evening and weekend work. A departmental spokesman said last night the talks had been positive but were unlikely to reach a conclusion soon. A BMA spokesman confirmed the doctors' union had taken legal action and discussed an out-of-court settlement. He added, "Clinical Excellence Awards are designed to recognize the exceptional contribution of doctors who find new and innovative ways of improving the quality and delivery of care, benefiting patients and saving the NHS money in the long run." The BMA has been exploring a deal during negotiations in which existing award holders would be able to retain the awards they have already earned. "We are working together with government to develop a successor award scheme which continues to encourage and fairly reward excellence."
Where the freaks at?